I started out as a medical secretary. I was the 13th employee hired. So there was less than 15 people when Northwest Buffalo Community Health Center then began. There was I was the 13th employee. Well, when we opened, there was about 4 patients a day we were seeing in the beginning.
So we're the first faces to the company. You come in and you're greeted by us, and you come in, say you're an hour early for your appointment. We want to get you seen. We want to give you the satisfaction that we can see you early, but we also need to make sure that we're keeping up in our flow of the day, making sure that all your information is prepped and correct, so that if medical records needs to send a referral to your doctor, we have that information. If clinical needs to decide if they need to do a procedure, does your insurance accept that? If the insurance is incorrect, that stops up the day. So PSRs have a lot to do with the flow of the day and a lot of the intricate details that you wouldn't normally suspect that we would have some magic worked in it.
One of the really neat things that we have at Neighborhood Health Center is multidisciplinary approach to medicine. It truly is a one-stop shop. You will get full, holistic healthcare here at Neighborhood Health Center. In fact, because of the comprehensive care that we give here, I'm a patient here, and my children are patients here.
So I myself have been here for a little over 7 years. I came in to the facility as a PSR, which is a patient service representative. From there, I quickly moved up to the registration trainer. So I trained a lot of people that came in new for the front desk and getting to know our programs and our systems and getting them comfortable to start taking patients on their own. I did that for a good chunk of time, and then I moved over to the CHW office over 3 years ago. Coming in as just a regular CHW, learning the basics, and then progressively moved up to the lead, the senior lead, and now I am a supervisor here at the Blaisdell CHW department.
So what brought me here to Neighborhood was the cause, what we do, what I see them doing for the community. I've been a patient with Neighborhood for a very long time. I have been a witness to the changes that's happening, what they're doing for our community, and I wanted to be part of that. I've always said one day I'm going to work for this company, and when I got the opportunity to work, I took it and I came in, and I've grown within the company. I'm part of a change. I'm continuing to see some amazing things that are happening and will happen for our community, and that is the biggest reason why I continue and will stay here at Neighborhood. The one thing that I've always noticed here, and I completely applaud them, is because they are about growth within the organization. They see the potential in people, they help them grow, and if you want to do something better, you want to grow and be in a different position, they will help you. They will get you there. And that's what I've got from my supervisors and other supervisors here. They don't hold you back, and they don't want to keep you where you're at. If they see your potential, they're going to push it. They want the best for not just the staff, but also our patients. And that's important here.
I moved over to Matina Neighborhood Health Center about 11 years ago. So the interesting thing is that Kaleida decided that they no longer wanted to support this primary care clinic, and they pulled out, basically, some economic reasons and various things of that nature. But the really interesting thing is that we were only closed for 2 weeks. Kaleida closed down in the middle of October, and by November 1st, we had reopened as Neighborhood Health Center. So that is a real tribute to Joanne Hafner and to our CEO and the Neighborhood Health Center organization, that in a matter of 2 weeks, they were able to prepare this building and get things transitioned over to open the doors. A lot of patients did not know that we reopened so quickly, and we got the word out. and many of our patients stayed with us. So they didn't really experience an interruption in care.
One of the parts of being a health center is it's not just giving access to care for people, it's actually making sure that we provide jobs in the neighborhoods where we have offices. And again, we take our mission so seriously that that's such an important part of who we are. We really say to ourselves and our leadership team, and as we hire, like, we need people who live near our offices to be able to work here and to learn. I think that that's one of the things that makes us really unique, is being here and ensuring that when you come in as a patient, you have a good chance of seeing somebody who lives near you. As one of the providers or nursing staff or front desk staff, and we get to be able to grow our community and improve our community's ability to have jobs, ability to afford health care just by us being here. I also think that there's so many people in the world who want to work someplace that makes them feel like what they do means something. And if providing health care in the third poorest city in the country can't make you feel like you're doing something meaningful, I'm not sure what actually could. It really does, fill your cup depending on what your values are. That's one of the things foundationally that makes this a place where a lot of people can feel at home when they get to know themselves and what's important to them.